Hello all wonderful learners. I welcome you all to Physiology learning. This series which I'm going to start is going to be the series where we will be taking learning through MCQs. Before that, please ensure that you subscribe the channel, share, and if you are liking the concepts, please put a like and put a comment. You can also suggest me what else you want. My Telegram group is there, Physiology Synapse to Success, wherein I provide free notes of whatever I am taking here on this platform. So today I am going to take an MCQ that is related to our GIT, and I want to ask you a simple physiology, but I am going to place it in the form of a clinical based scenario, which is a very typical pattern of the MCQs these days. So the question says that there is a newborn with severe diarrhea and he is found to have an inherited defect in a glucose transporter that is resulting in the glucose galactose malabsorption and is necessitating that the boy has to take a glucose and a galactose free diet. Which of the following transport protein is responsible for the entry of glucose into the intestinal enterocytes? Options are GLUT2, GLUT5, SGLT and SGLT2. So before I give you the correct answer, let's look upon the glucose reabsorption in the lumen. So on the luminal side, that is, there is a secondary coactive transport mechanism which is nothing but SGLT1. SGLT2 is more important in the PCT for glucose reabsorption. Once the glucose or the galactose bind to this cotransporter, they will come into the cell and they will be transported on the basolateral side by facilitated diffusion, that is GLUT. This is a secondary coactive transport mechanism which is actually depending upon its energy on the primary sodium potassium ATPase pump which is present on the basolateral side. So there are three aspects. One, basolateral side पर sodium potassium pump है, ठीक है, basolateral side पर facilitated diffusion है GLUT और luminal side पर SGLT. अब इसमें very specific answer will be SGLT because this is the one which is present on the luminal side. Luminal side पर क्या है? SGLT, which is actually taking glucose or galactose. और इसकी जो energy है, it is not causing a direct breakdown of ATP, but it is using the gradient that is created by the sodium potassium ATPase pump. Again, it is energy dependent. Look into the other options. So we've now got the correct answer. C, SGLT1 is the correct answer. SGLT2, I told you, it is more important in the PCT for glucose reabsorption. GLUT2 is present in the beta cells of pancreas, and GLUT5 is an example of facilitated diffusion, but is more important not for glucose but it is for fructose. This is again very important MCQ. For fructose, और ये कहाँ मिलता है? This you get it in the sperm and you get it in the jejunum. Remember, glucose is the chief carb form for reabsorption, right? You can also go through the explanations for your further understanding. But for now, this is all for this MCQ. Remember, this topic is important for physiology as well as biochemistry and clinical based question. You can get a correlation with your pediatrics. Thank you and have a happy learning.